Why should you be having sex and you're not orgasm? Somebody that is into you, you must have built that atmosphere of very strong sexual energy. And then the person is even not seeing you, hearing your voice, and is getting wet. I mean, that is
it a thing?
Very possible. Majority of Nigerians' masculinity are very unhealthy.
It's very, very unhealthy.
Very.
Come
what
here,
they call
sit
masculinity.
Shut up.
You respect his end. You know that kind of masculinity that you ooze. You don't demand it. You don't give a head to a woman. What are you doing with her? Up to 85% of women will not achieve orgasm with penile penetration. So what are you doing with her? Lots of women, by virtue of the way we are wired, cannot even achieve orgasm without clitoral stimulation. So you say you don't want to do foreplay, no fingering, no head. My dear, what are you doing? Like the problem we have as Nigerians, as Africans, is we use spiritual is our way of explaining what we don't understand. It's our way of being lazy. Even when people come to therapy, they are still expecting the therapist to give them anointing oil or give them water. Like you tell them that, what we are going to be doing is called talk therapy and we're going to be talking. They're asking you, just talking? And then I'll tell you, it's talking professional. Nigerians, we tie spiritual or spirituality to everything we cannot explain. As much as I believe in the place of spiritual, I believe that most of the problem issues that people are telling is one witch, is one wizard. Actually, your brain is the witches and wizard.
Actually.
Yeah.
And there's also a new study that they say if you masturbate, your chances of prostate cancer will decrease by a certain percentage. So what do you think, based on your study, based on what you know and experience?
So masturbation is a choice, really.
Is it bad?
Women want to feel connected. They want to feel needed. They want to feel like you are thinking about them. You are missing them. But you as a man, you are thinking everything your brain is thinking about is sex. So it just doesn't work that way. So for a lot of women, they feel like what you are opening, I should open and you put it. My dildo is doing it for me.
But dildo does not give emotional connection.
Is a man giving? Is a man giving? The man is not giving. They think everything is about money. Oh God, you see, we have money problem. Actually,
yes,
we have money problem because you see, as a man, you were raised to be a provider.
That's our problem.
You don't know differently. So everything they keep putting in your mind, you have to take care of your wife, you have to take care. You see, the way we are conditioned, the way I like to explain it is, it's a drive. I mean, I know that you tech people to understand that. So that drive, whatever you install there is not automatic. You don't go into your drive, I want to bring something out, and you bring out what you didn't put there. So what were imputed in your drive, in a lot of cases were imputed by religion, imputed by culture, imputed by environment, trauma. Your parent, especially parenting, your parents are clueless. I don't even understand what parenting is, does not understand stages of development. That's even another thing. Brain, people have studied the brain.
Yes.
They understood that, there are stages of development in children.
Yes.
And there are things that your capacity can carry, and there are things that your capacity cannot carry. That is how the brain develops in a healthy way.
Yes.
So from age 0 to 1, 1 to 3, 3 to 7. So they broke it down to ages. So these are the things you should be able to do. Yes. These are the things you should not be able to do in, say, emotional sphere. So there are like 8 of them: emotional, physical, social, intellectual, sexual, spiritual. As a Nigerian, add spiritual to it, financial. So there are like 8 of them. Yes. Now, so there are things you're supposed to be able to do, and things you are not, your capacity cannot do it. Now, what we do in Nigeria, the way we are raised, which is what we call resilient, what your brain cannot carry is what they will make you to do. Now, the one your brain needs to develop rightly, they will say you cannot do it. So at the stage where you are learning to trust, you are learning to build trust, you are learning to build emotional connection, they don't allow you to talk. As a man, they tell you, be strong, don't cry, keep short. Those are the things that they tell you, be a man. Somebody lied against you, you cannot say, and then you are crying. They will say, is it because they lie against you that you are crying? You see all of those. So when you become an adult and people are not allowing you to talk, not allowing you to talk, when any little thing happens, you don't have capacity to negotiate, you feel threatened. because that was what was in your drive.
Yes.
Now, this is how you develop your folder inside those drive. So in a lot of cases, the folder of Nigerians are full of trauma. So every time you want to bring out the emotional folder, what you see inside is don't cry, don't touch, don't look, always come first in your class. You come last, they laugh at you in the class. You know, so many things. So thousands of ways.
Yeah, it's a programming.
Programming. That's what you. So in a lot of ways, cases, they don't even say it to you.
Yes.
It's subtle. You pick them up, your brain pick them up by just seeing, watching. Maybe your parents are teaching you how to love, how to have sex.
Yes.
You are living in a room where they use curtain to demarcate 6 children and mommy and daddy. How do you understand what intimacy means? What it means to, can that man and woman engage in romance of like 30 minutes, 40 minutes? Can they give a head in that? So you are teaching. They don't need to see.
Yes.
It's in the environment. So they are picking it up. So this is what it means to be a man, to love. So when you love each other, you come back from work, you don't hug, you don't kiss. Where is my food, woman? That's what you do. You know, so you build all of that.
Yes.
So when you become an adult, when you want to relate emotionally, you don't pick it from heaven. You go to your folder, to your drive, and you bring it out. And because it's been programmed, you've learned it. So it's so difficult to reprogram. And that is what we call cognitive reconditioning. And without, that's CBT, CBT. Cognitive behavioral therapy. And without cognitive reconditioning, there can never be behavioral modification. And behavior is difficult to modify as adults because the brain is no longer plastic. When you were young, it's so easy. You are picking them up so fast.
Very malleable.
Your brain is, sucking them, everything. Right? When you become an adult, first of all, you really, and that's what we do in therapy. So that's why you see couples that are fighting, whether over sex or anything. You are trying to teach a man that has never seen his father touched his mom, hug or kiss. You are saying, you need to kiss me for 5 minutes. You need to, my love language is touch. He doesn't understand you. He cannot speak. You are speaking Latin.
Yes, he doesn't understand what you're saying.
He doesn't understand it. So you are feeling shortchanged. You are feeling like, he's not giving it to me. He doesn't have the capacity. And a lot of women are now frustrated from like, why can't you just do this? Right? So that problem, and of course, you see, women in a lot of cases will tell me, Dr. Tolu, is it possible? Is the orgasm thing safe? Is it possible?
Yeah, I was about
a
to
lot
ask you.
of them have given up.
Is it compulsory?
Why should you be having sex and you're not orgasm? See, it doesn't need to happen all the time, right? Of course, there are quickies. And see, quickie is interesting.
Wow.
When your sexual energy is already strong. So if you're having a quickie with a woman that the sexual energy is, maybe she wants to collect money or something, right? But somebody that is into you, you must have built that atmosphere of very strong sexual energy. And then the person is even not seeing you, hearing your voice, and is getting wet. Wow. I mean, that is
it a thing?
Very possible.
Oh my God.
Just hearing your voice, the person gets wet. You don't get there by not touching, not holding, and being masculine. Masculinity is actually beautiful, but healthy one. Your masculinity can be very healthy, and majority of Nigerians' masculinity are very unhealthy.
It's very, very unhealthy.
Very. What they call masculinity.
Shut up.
You respect his end. You know that kind of masculinity that you ooze. You don't demand it.
Yeah.
You ooze this. It flows because you know whom you are from the inside. But a lot of our men have serious low self-esteem. And that low self-esteem was caused while they were growing up. By people shutting them up, not allowing them to call. People that you grew up with one wicked auntie or stepmom and all of those. All this boy. Oh God, that's a different ball game. This Igbo apprenticeship. Yes. Oh my God. The people that grew up in that system. Oh God, empty. Completely empty with a lot of money.
So they were just all about chasing the money and everything.
At a point, I was seeing a lot of them.
My God.
As clients. It didn't even occur to me. I'm not Igbo.
Yes.
But I began to notice, polished, clean, slim, yellow wife, even with 3-4 kids,
Beautiful
still
women.
hot. And then you are seeing the man, money. The wife is driving G-Wagon, the man is rich. And by the time they come to therapy, you see that marriage is completely gone.
My God.
Because they are they are operating at
Spectrums.
different level. The man cannot speak good English.
My God.
The woman is ashamed of him.
How did they not get married?
You see,
His
they
money,
get married at 19, 18, and then he's the one that saw her through school, and then now she finished school and her eyes are open and saying, I deserve better. And then he's looking at the man like this, and the man actually is looking at himself like this as well.
Yes,
Anyway,
low self-esteem.
yeah. So all the money, and this didn't just happen one day. You grew. Do you know what it means for you to be sleeping in the kitchen? Because you are serving a man. I mean, it happens a lot. Or you are sleeping in the shop. And then you wake up in the morning, you are sweeping the shop, and you see the children, your age mates of your oga, that they are entering SUV with socks, and they are going to school, and you are sweeping the floor because you want to be rich.
Wow, boy.
Wow, but you want to be the one to take care of children you didn't give birth to. Like they say, oh, you are giving birth to 5, 6, 7, 8 children, and you are telling the first one, you are going to be the one to take care of your young ones. So, like for rich, a child should be taking care of children.
No.
So you see all of that. So that enters into the bedroom. When your ego is zero, erection is very egoistic.
Yes.
So your ego is zero. When it comes to the bedroom, and the woman just say, why don't you do it like this? Your erection will just disappear.
Go down because you are feeling intimidated.
Because you're already empty. But if you are,
man.
you are masculine, your masculinity is healthy. You're like,
Decent.
oh, babe, okay, let's talk about it. How do you want it? And then you guys can share, and then you're not feeling intimidated. You're not feeling like used or maybe talked down on or something. But the reason why you are feeling like that, you think is your wife. It's not your wife. She's not the cause of your problem. And a lot of women that want to fix that became very, they grew in resentment.
Yes.
Because they are trying to fix their husband. So they hustle, they try to change him and then the more they try, the more they shrink themselves till they get to a point where they now resent the man completely. How do you make love to somebody you are resenting?
It's impossible. Dr. Tolu, the fixer. Yeah. Okay, so you said something that I really struck me, and I had to hold it so that I don't miss it. Okay, so you said children should actually notice, the environment should be in such a way where they can notice what real connection and love is. But how then would you then curtail children that now go into curiosity, where they start to want to practice it with their mates at a very young age because of what they have seen at home? Because I mean,
the reason why they want to practice is because of what they have seen. Because it's not because, see, when I said, I'm not saying, okay, so don't miss it.
Yes.
I'm not saying practically show them how to give a head or show them, no, that's not the point. Show them what it means. You see, because, I mean, you can't even do that. Like the description I gave where you have cutting.
Yes.
You can't do that. So even if you guys are going to have sex, it has to be kurukere, that kind of sex. So, but the kind of love that I'm talking about that you should show them is what it means to wake up in the morning and then you look beside you, you see your wife or even your husband, then you peck the forehead, and maybe the person is sleeping, the person is not hearing you. It flows from the inside like, oh God, I'm so blessed to have this beautiful woman by my side. And then you peck her genuinely because that's who you are.
Yes.
And then you go out and then you come out, and when she wakes up, you guys hug each other. Good morning, babe. Did you sleep well? And then you hold each other, you talk. Maybe you pray together. Not the only thing we do here as couple is pray together. Your mind is not together, you are praying. I don't know. The prayer is not a prayer of unity. Yes. So so the way you relate, the way you touch, the way you talk, the gestures that you give, the way you look, the words that you are saying, those are the things that I'm talking about. Now, if you give the right education, the child will not be curious. So when I was talking about cutting, I'm not saying that you should show them. Sex education, we actually need sex education. It's not teaching children how to make love. Far from it. They are not the same thing. shows that you need to show them what emotional connection
Sex
means.
is first connection before.
What it means to be healthily connected. What it means to be in love with somebody.
Yes.
Healthy kind of love. Those are the things you show children, not the practical aspect. When you show them, when you raise a child that is emotionally intelligent, emotionally stable, intellectually capable, socially in charge, that's not the kind of child that everybody is saying, oh yeah, come and see, let me show you. She doesn't need to know what is there.
Yes.
She knows that, okay, maybe when I'm 18, I want to see, right? But now I don't want to see, and you cannot force her.
Yes.
That is because she's coming from a place where she can express, she can listen, she can share, and she can see, the way they attract, the way they love each other, and then she can learn from it. And she can easily walk to mommy, oh, mommy, what does it mean to have sex? What does it mean to? And then you guys can, not in Nigeria, if you have said, who is teaching you, you get pregnant. But that's what we still teach.
Many of us, they shut us up because when we're young,
Yeah.
they close our eyes. They don't want us to know. They beat us.
You see all those closing of eyes is what is even making you to be
more curious. But okay, this thing that when you're out,
What
I'll go and
is,
look for it.
what is going on there? What does it mean?
Yes.
My daughter, you saw her?
Yes, I saw her.
There's nothing we don't talk about.
I was about to ask you, at what age do we now teach them about?
So there are ages. So there are in sex education. There are. It's like a class of its own. Like it's serious education you have to go through. Right, like a table of what at all of these stages that I mentioned, 0 to 1, 1 to 3, 3 to 7. There are things that a child should know sexually. Like when I'm talking about those spheres, also sexual sphere is there. So what should they know? What should they not know? So all of those stages is something that you really, really need to learn and understand. I still taught it in my sex therapy class last Saturday, and I told them that they need to come up with like a training for parents on sex education. What are the things you should teach
your
children
yes.
regarding sex at what age? So it's not where do you touch, how do you touch? Those are skills. Sexology or sex therapy requires there is the anatomy side, which is the medical side. There is a psychological side of sexology. There's a relational side. And then there is the skill.
Yes.
The skill is not business of children and teenagers. The relational, the anatomy, the psychological are the areas they need to learn.
Yes.
So the skill, and that's why you see all of these social media therapists and sex coaches and all of that. All they teach is skill. You are teaching somebody whose brain is formed. Skills. You are teaching somebody that believe that if he goes down on a woman, then we have what do they say they have throat cancer,
mouth sores, infection.
Different. God, a lot of lies. I mean, I see it everywhere. I mentioned it in one of these international training recently, and one young person said, maybe among your mates that Gen Zs we don't think like that, but that's not true. Generally speaking, it is still everywhere. I mean, if I post it now on my Facebook page, I posted this recently because of this, that, can you go down? I mean, I talk about cunnilingus and all of that. Yeah. And then some of them were like, and I went to check because I went to check their ages, and I saw the majority of them were still saying, they were young people, Gen Zs, and they still say, is it food? Why are you, the mouth you are using to praise God? In fact, some people will say that if they kneel down and then put their head, it means that they are suppressing their destiny. Like, are you okay? Oh my God.
Yeah.
So, yeah. So when you have all of this, so when we are talking about sex education, it's not skills. It's basic understanding of the anatomy of the psychological and relational aspect. Somebody tells you, I like you, oh, you are beautiful. You don't get carried away because you had it enough. You didn't grow up in a place where nobody validated, like our men. You were not validated when you were growing up.
It's terrible, man.
So when you become an adult and then they are showing you small love, and then you are just so carried away. Yeah, so many things.
Look, I have plenty of questions to ask you. Jesus. Okay, so is there any limit? Is there a limit in sex in terms of what your partner wants? Some partners want that cunnilingus. Do you do anything your partner wants you to do?
So this is the way I like to answer that question. Yeah. Sex is deep.
Very, very.
And the practices, sexual practices are just so many. And curiosity, keep increasing. People keep wanting more dangerous sex, different kind. People want to see blood. So people want to see poo-poo, whatever. Yeah, some cannot come unless maybe they see feces and all of that. Of course. In fact, there's a name for it.
Dr. Tolu, is this like something you know or be? I just...
in one of my sexology classes,
Yes.
There's a name for it. There's actually a name for it. It just kept me. So, and they don't look, so in sex training,
Yes.
they don't look at it the way you are looking at it like this. It's a preference. It's a preference. It could be maybe a kink or fantasy. It's not nyama. In fact, if your client is coming to you and say, this is my preference, there's a name for it, faker something. There's a name for it, I can't remember really. And your client is saying that, oh, we're having problem because this is my preference and my wife does not want it or my husband does not want it. Especially it's men that really have that fantasy. And then my job as a sex therapy is not to say, so I want to look at, okay, so can it work for you as a woman? Why don't you like it? Why don't you want to do it? Or if you say you want to do it just because you don't know how to manage it, my job is to teach you. Maybe you use towel. I teach you some of the things, anal cleanser, some of the things that you can use to help you before you do all of it. So yeah, so it is normal. So these are practices. So that's why I said sex is deep. So it can get to that essence. It could be blood. Some people want to see blood before they get aroused. Some people want to see wound.
It's deep.
Yeah, it is deep. Some people are so. Did you know the problem with pedophilic disorder? The level, that thing is such a pandemic.
Jesus.
People that the only thing that get them aroused are kids, children, babies. You know there are so many in Nigeria.
I've heard one is pregnant women that get them aroused.
So you can't. There are just too many. That's why I say sex is deep. So it's deep. So the thing is, now as deep as it is, you can't get to the end.
At all. It's destruction.
You can't get to the end because you just keep looking for more, keep searching for more. You want threesome, you want foursome, you want tensome, and then you want this, you want that, you just keep going. But there's no harm in fantasizing, in liking what you like, in exploring.
Yes.
Right? But explore with your brain.
Yes.
So you don't explore and then you pass away. People die a lot from sex, from sexual practices. People die a lot. So Google it. Use different people that died in the course of trying to try something. So it happens. So you need to explore with your brain when you're exploring. That's number one. And then as couples, whether married, whatever you are doing, when it comes to sex, so because it's deep and there are a lot of things that you can try. There are kinks, there are a lot of non-monogamous relationship. People are in relationship where you're emotionally connected to one, financially connected to one, sexually connected to one.
It's possible.
Like these are real practices. These are not even secret. That everybody knows what they are doing and everybody is aware. Unlike Nigeria, which is our problem, we are very secretive.
Yes.
We are pretentious.
Religious.
Religious, but not spiritual.
Spiritual. Thank you.
You know, yeah. We are so pretentious. Nigerians have a lot of sex. I hope you know.
So, you don't need to tell me. I read statistics. I saw it.
Thank you. But we have the biggest synagogue in the world.
Yes.
We have this, we have that. And then you would think we are so rich. So who is having the sex? Who is having the sex?
That's a good question.
Yes. So you see, and then we'll be pretending, we'll be acting like see, I've seen so much that, all of those things doesn't even like...
Chew you.
Whether you are an angel, sex, when it comes to sex, I don't trust you. Because I actually also feel like sex is very spiritual.
I think God puts it in us.
Yeah. So the thing is, so when it comes to how far is too far, should somebody make you to do what you don't want to do, or should you... What happened is, number one, understand yourself. And then, there's nothing bad in exploring.
Yes.
But explore with your brain. So you don't explore and pass the limit. And pass away through there, right? So, and again, I don't think... So there is a place of I love you,
Yes.
and I want to try what works for you. That's not bad. If you love somebody, you want to do what makes them happy. But at the same time, you also need to ask yourself, do I feel used? Do I feel compelled? Do I really want to do this?
Important.
So you should not be in a situation where somebody is making you to do what you don't want to do. So it's a different thing for the person to share with you and you're like, oh, this sounds interesting. I don't mind trying. But it's a different thing for you to say, I don't, inside you, you know you don't want to do it. But because the person is saying we must do it, you are doing it, then you are zero. Something is wrong with you.
Yes.
So that's how to balance, that question of, okay, my partner wants it. And again, another thing you want to look at it is, what is the danger? What are the risks in doing this?
it,
If it's something that doesn't carry, when you love somebody, why don't you want to do it? So when it comes to giving a head, you don't give a head to a woman. What are you doing with her? What are you doing with her? Because up to 85, some school of thought say up to 85% of women, some 75, some 85, different school of thought, will not achieve orgasm with penile penetration. So what are you doing with her? So you're just penetrating, she's not coming. After some time, she gets tired, she feels used, she feels like she's doing it for you. A lot of women, by virtue of the way we are wired, cannot even achieve orgasm without clitoral stimulation. So you say you don't want to do foreplay, no fingering, no head. My dear, what are you doing? Your penetration is nothing.
Yes.
In a lot of cases. In fact, for a woman, I believe, according to research, vaginal orgasm is more explosive, right? But vaginal orgasm is not what you achieve so easily. It is believed that, the clitoris extended inside the vagina, So if the penis is touching the base or the tissues of the clitoris inside the vagina, that is what in a lot of cases give the orgasm. So for some people, it's about the tissue, the clitoral tissue that extended inside into the vagina. So in a lot of cases, when the penetration is taking place and, what some people call the G-spot, and the penis is able to touch, rubbing on that spot continuously and consistently, and then you can achieve orgasm. So, or some people talk about the entrance of the cervix, which is the 6 spots, which is very difficult for the penis to get to that point. And that is why some people sometimes they make love and it feels painful and it feels sweet at the same time. So it means that the penis is touching certain spots, and those are the spots that give the vagina orgasm. So the things that really make women to enjoy sex, even men, are the muscles, the tissues. And for women, they are majorly at the vulva. Inside the vagina is just very slippery, but the nerves ending are majorly.
So that means the outside of the.
The vulva itself, the labia, the clitoris. Those are the things that make women to enjoy sex. By the time you are going inside, the wall, the nerves endings are not there. They are smooth. The walls, even though the tissues and the nerves are there, but the endings are not there. So it's at the outside or some certain spots on the inside. So if you now say that, I don't want to finger, I don't want to give a head, what are you doing?
Okay, because I was also thinking that if you're having sex, it's not be easy for you to just be looking for the area that make your wife, so that means you have to add some extra things.
So basically is be creative.
Okay, that's the word I'm looking for. Yes.
And that's why some women like to stay on top. And when you are staying on top, in a lot of cases, it is because the penis is still rubbing the clitoris.
Yes.
Or the tissues, the base of the clitoris inside the vagina. That's why staying on top still works for you.
Yes.
So if you are creative with positions, right? You are creative with position, you'll be able to, some women will tell you that there's some position, something just happened and it was so sweet. Normally what I tell couples is be creative with position. Try different things. Try it on the freezer, on the shower, on the freezer, or the washing machine, or the couch, in the kitchen, in the shower, just try different things. In the process of trying, also put your mind in it and be able to remember what you did that felt differently. And then note it down and plan
Practice it.
to
Do it again.
redo it again.
Yes.
So that way you can see what works. But if you are just thinking like it will just come on its own, in a lot of cases it will not come.
Yeah. Okay. So let's get into suicidal, mental health. And we'll talk about you personally. Okay. So have you ever had suicidal clients or patients, people that want to commit suicide, and how do you help them? How is it? How do you take them from that place?
So suicidal ideation, just like depression, could be as a result of something. Could just be nothing.
Nothing. Yes.
Nothing. And I've had a few clients. I do more with sex and marriage, but because I also do mental health, I mean, I've had a few clients that if you look at the primary, cause of the suicidal ideation is attached to relationship. Relationship is actually one of the major cause of depression and all of these mental health issues. And that is why relationship issue is not what you take lightly.
Yes.
And so I've had one situation, I mean, to be for confidentiality reason, I might not say too much, but one that really stood out for me. And at the end of his session, I remember him telling me, coming with his suicide note. I saw him for like 3 months. And so he came the last session, the last day that I will be seeing him, he now came with his suicide note that he wrote the first day before coming to me. He wrote the notes before the first session, but he didn't mention it. So he wrote the note. So like I said, it was on antidepressant. I think it was just messed up. You know, sometimes this medication also
You messed up with your listening. So if you don't even use it, it also disturbs you.
So the withdrawal symptoms too can if it's not well managed. So he was just going through so much. And then he just asked himself, like, what's the essence of all of this? Let me just die. Like, this is just, sometimes, depression just push you to that valley where all you see is just darkness.
Yes.
You don't see any way out. So he has gotten to that point and you're like, what, this stress is just too much. All the reactions to the medication was just messing with him and all of that. So he said, before he now, did that thing he wanted to do, he was like, let me just call my friend and talk to him. And he was like, oh boy, so that at least let somebody just know, maybe in case they are looking for him, somebody like, so he just chatted with him. Oh boy, what's all that they just chatted. And he said something, just said, tell him that, so the guy knew he was going through so how far? He now said, oh boy, see, everything don't tire me. That drug is even messing with me than. So the guy knows, since you don't try that one, why not try therapy? It was not like, what was therapy? Like therapy now, that all those people that maybe you can just talk to someone, not drug, yeah? And then he was not like, I don't know about that. So the friend now like, wait, let me Google. And then they Google and they found me. And that was how the friend said, I'll pay for the first session.
Wow.
I booked him and then he came. And I was seeing this guy every week for 3 months. And I need to quickly drop it there that in Nigeria, Nigerians, I don't know, we want quick fix. Everything. Therapy does not work like that. Therapy is not medication. You need to consistently go. Do you know what it means? Like I was describing for you, to pick the brain. Like it's more like practically you are rewiring the brain without medication. So first of all, we want to know I want to understand how you were. How you even formed.
Yeah, what was your programming? What was your beliefs?
Exactly. So when I understand that in the first place, so I want to give you new experiences to override, because you don't change, there must be programming.
Yes,
new experiences, more like new programming to override the old one. Not like to override it completely, but it will just be becoming fainting till like, even if it doesn't disappear completely, but the new one now is the one controlling your thought pattern, right? Yes. So all of that requires a lot of effort, a lot of hard work. But Nigerians want to come to therapy 1 hour, 2 hours, 2 weeks, 3 weeks. Yeah, that is so common. And if you go after 3 weeks, I know you will come back. We'll come back in 6 months' time, right? So this guy, to quickly tidy that up, came. And then on the last day, this guy is fine. Fine, this guy that carry everything is good, that carry weight. What you call a fine man. To what I think a fine man is. So you look at him and you feel like he has everything going for him. Why is he depressed? But he see himself like he has money. He see himself like a pauper. He
Eh?
see himself like he's the ugliest person. Guests are hitting on him, coming to his house. He will be the one driving them. Yet he still feel like nobody wants me. You see, depression will lie to you to a level where you will feel like you are the worst person on earth. And like I said, it doesn't. Sometimes there are triggers. There are things that happen that sometimes it's just chemical imbalance. Nothing pushed you, and then from there you move to suicidal ideation, right? So I have seen that. I have seen that situation, and I've seen that it is possible with the right therapy to come out of suicidal ideation. I have seen that people can get better. In fact, I remember telling him he doesn't have one single picture on Instagram. After the session, I'm like, go do photo shoot. Yeah, I do that for my clients, especially those that have low self-esteem. Go do photo shoot because they won't post pictures. If you see somebody that a lot of people, not everybody, I mean, but a lot of people that are not posting pictures, self-esteem could be.
A problem.
You are looking at them and you're like, oh wow, so fine. But they look at the mirror, they are seeing monster.
Yeah.
So he did the photo shoot and posted, and you need to see comments. And that I have prepared him. Some people might even say you are not fine. You have gotten to a point where your opinion about whether I'm fine or not, what has that got to do with me? It's your problem. So I worked on him to that level so that even if people are making, but every comment under that post, because he brought it to me, were positive.
Excellent.
So yeah, so that's a very clear experience of suicidal ideation.
Yeah.
I have seen a few, like I said, and relationship, I mean, even according to research, is one of the major factor that leads to suicidal ideation. So, but can people get better from it? Why not? With the help of course, with sometimes you might actually need medication quickly to just reset the brain.
Yes.
Before, and then you work with a therapist. Yeah, why not? People can, and I feel like that thing is actually very common in Nigeria, but we don't have data a lot. Another thing I was doing research on regarding suicidal ideation is, in some parts of Nigeria, if you commit suicide, not commit suicide, let me rephrase that. In some parts of Nigeria, if you die by suicide,
Yes.
right, the rituals that your family will do before they will bury you, the rituals, we don't even look at that. We don't look at the psychological implication of that because that is not even being discussed among
Mainstream.
scholars.
Yes. No. It's not.
In any part of the world. I have witnessed one in my town when I was growing up. I couldn't get over it. I was young. I was still I should be like maybe 10. But you see that horror movie, because I used to pass that place to my mom's house. That I can never forget. The way they will use some things to tie the house.
Yeah.
They would like it's a whole lot. People tell you the rituals that follow suicide, dying by suicide in Africa, you will be shocked that you look at the psychological implication of that and you see the reason why even after the suicide, the families are going through unimaginable level of psychological issues that nobody is even, looking at. So yeah, but I feel like people can get better.
Yeah, but Dr. Tolu, where is the place of, because I know you are very spiritual as well, where is the place of spirituality? Like maybe they're chasing somebody from the village, or there is something that happens psychology.
Oh God, I don't want to
Because
say.
this is Africa. You can't take that away.
Yeah, I believe in the spirituals. I believe that there is a spiritual power that controls. Even psychology believe that if you want to get better, you need to hold on to a higher power. It helps.
Yes.
Your higher power might now not be Jesus, might not be God, might not be Imam or whatever. It could be sun, it could be water, it could be whatever you want to call your spiritual
Energy.
energy, but you need a higher power. It gives you hope.
That hope. That's the hope
Yeah,
people
that
need.
hope is very helpful.
Yes,
and that is why the place of the spiritual cannot be overruled. But I feel like the problem we have as Nigerians, as Africans, is we use spiritual is our way of explaining what we don't understand.
Yeah.
It's our way of being lazy. Even when people come to therapy, they are still expecting the therapist to give them anointing oil or give them water. Like you tell them that, what we are going to be doing is called talk therapy and we're going to be talking. They're asking you just talking. And then I'll tell you, it's talking professionally, But I think Nigerians, we tie spiritual of spirituality to everything we cannot explain because we don't do research, we don't make effort to understand what is happening to things. As much as I believe in the place of spiritual, I believe that most of the problem issues that people are telling is one witch, is one wizard. Actually, your brain is the witches and wizard.
Actually.
Yeah.
Your wiring, the pattern.
Exactly.
Pattern, things you were exposed to,
Your
things you saw.
conditioning, yeah.
Yes, the conditioning
Yeah,
that you have.
yeah.
So those things,
And your conditioning is so strong.
it's more powerful than any.
Nobody can change it.
Yes, so.
I believe that it is only therapy that can change it.
Yes.
And therapy don't change it by telling you, stop thinking like that. Now, like some of us, that's what people think is therapy. No. We will take you to a point where you now understand, oh, this is why I am like this. And then you ask yourself, do I want to keep being like this? Or so you'll be exposed to your options and the consequences of your options. So you make an informed decision and say, this is the one I want. So that is why if I work with you, if you are leaving your marriage, for example, you want to divorce and I work with you and maybe you feel the person is not giving you money and in the next 1 year, the person become a billionaire. You will still not want to be with that person.
Yes.
Because we'll have explored all the options. How this can happen, and then you make up your mind. That's what therapy does. So therapy is a solution and deliverance that some people are looking for.
Even when you go for spirituality, there are things that they tell you to do. They are more like wiring you. They'll tell you to separate yourself. They'll tell you to fast. They'll tell you to keep yourself in shape, stay from those things are things like they do in therapy as well.
Right.
But people want that mystical thing. Oh, if I don't have anointing oil, if it's not.
Yeah.
Yeah.
Which is also their conditioning because you've attached a level of power to the
Yeah,
anointing oil, to the
Yes.
and even the Bible says to some he gave apostles, to some counselors, to some
Teachers.
and teachers, and I mean different type of them. And see, your pastor is not your therapist. Your pastor is not a sex
Even your
therapist.
pastor needs therapy.
I'm telling you. And that is one area we are getting it wrong in this part of the world. And that's why some people are being messed up.
Yes.
Like now, that's why the pastor that had tattoo, everybody, is
shouting.
because of the way you have, especially, because of the space where he operates as well.
Yes.
As a marriage counselor, that level of belief and respect they have for him. Do you have your personal conviction, or is everything that the pastor do that you too you have now to do, and then you have to be like them or something? So you really need to have your conviction and personal encounter with God. And I don't know how we are going to come out of here, because if you think, oh, Nigerians are getting better, you're just looking at very minute elite.
Yes.
The people that are, if the majority of us are still with that mindset, that level of conditioning. That's somebody was telling me that, gender identity, sexual orientation, lesbian, that are people that they operate freely, that their communities that is not that deep in Nigeria anymore. I said, where are you operating from? You're operating among the entertainers.
Yes.
We had everybody in that place are self-aware. I said, what is the percentage of those people compared to a lot of people that are struggling with sexual orientation and gender identity issue all over Nigeria? The ones in the village, the ones that they don't even know, the one that they don't even know what is going on in their body. Do you know how many?
Yeah.
You are 0 point something in your circle,
yes.
right? So a lot of things are going on that, Nigerians, generally speaking, I will say that we need psychological awakening.
Yes.
We need to wake up to therapy.
Yes.
We need to understand that there are explanations to these things that are going on with you. Stop giving spiritual explanations to everything. And your pastor is telling you, don't finger, don't give a head, don't do, and then you are saying, because my pastor say, you are the one that will face the consequences of the bad marriage. You're the one that will be feeling the heat. You are the one that your husband will be cheating. I'll still come to church and still be appearing holy. You are the one that will be connecting to dildo without emotional connection.
Yes.
You are the one that will be going outside to sleep with another man because somebody said something. So if there is anybody that needs to work on himself, it's you.
Yes.
Find yourself. Go to therapy. Ask questions. Ask yourself, why am I like this? Why do I even talk the way I do? Why do I walk the way I do? Why do I fall in love the way I do? Why do I get angry the word. What is my personality? Ask all of these questions because we don't even know
Yes.
ourselves. Your attachment is messed up. Your attachment style is messed up. Everything. And then you are not doing anything about it. And then you are just flowing. So people program you and you carry that programming. The people that program you in response to their trauma. And then you carry that for the rest of your life as well.
Okay, two more questions. Okay, one more question.
I thought we are done.
You know, I told you I wanted to touch masturbation because that part is. So, what do you think about masturbation? I saw one of your old video where you were talking about. You filmed this video on your YouTube 11 years ago, where you were talking about is masturbation good? Should it be practiced? You know, and there's also a new study that they say if you masturbate, your chances of prostate cancer will decrease by a certain percentage. So, what do you think based on your study, based on what you know and experience?
So masturbation is a choice, really.
Is it bad?
No. What's bad in that? It's a choice. The people that are telling you that it's bad, they are the ones that are doing it the most anyway. That's the truth.
Does not feel like you're cheating on your partner. So there are some marriages that where the husband masturbates and or the wives use dildo.
So if your partner, maybe by virtue of distance or something, and then you masturbate or you have sex, phone sex and all of that, what's the big deal?
Okay, it's true. There's phone sex. Actually.
Of course, there's phone sex. Your partner is not with you, and then you are horny. What should you do? The two of you can have sex on phone. It's possible, right? And I don't. What is wrong with my? Anyway, you're asking me before they hold my voice. I don't see anything wrong in masturbation, but I will say it is your choice.
Yes.
You do whatever works for you. But the issue of prostate cancer, what do you call it?
Cancer.
Prostate cancer. You know, there are some school of thought that is arguing against ejaculation. It's basically ejaculation and prostate cancer. It's not necessarily masturbation. It is ejaculation. Because in a lot of cases, when you masturbate, you will also ejaculate. So it's basically ejaculation and prostate cancer. That's what the research is talking about. Some people are saying, oh, it's not true or it's true. It's not linked to cancer. But I can categorically say to you that regular sex will give you a healthier prostate.
Yes.
That's the truth. So I don't want to probably link it to cancer, but regular sex will give you a healthier prostate. And so whether you, or maybe regular ejaculation, so whether it's penetrative ejaculation or whether it's masturbating ejaculation, you know, whatever works for you. And of course, orgasm is good for you, even as a woman. Like you are not releasing, you are not achieving orgasm, you are missing. And I mean, I don't like to say it categorically, but there is vagina atrophy.
Yeah.
If you don't put your vagina to use, you start loosening it. Do you understand?
Yes, ma'am.
Practically or literally, that's not what it is. But your vagina will be going into extinction if you are not using it. Because you need to put it to use, because when you put it to use, it needs blood to stay healthy.
Okay, so Dr. Tolu, I think I was watching one interview where you said that you actually had, where you called your husband at some point that you were having some mental health challenges and he drove from Calabar
Okay.
all the way to come and meet you. Yeah, so what was it at the time?
So, you know, remember I said at that point, I think I was just trying to I think I was depressed.
Are you serious?
Yeah, I think I was, but I didn't know
How old
what
were
it
you?
was.
Did you know all these things? Were you ever gone to school at the time?
So, I mean, I was a graduate, you know. I'm not sure I've done my master's at that time. None of this, all of these studies in psychology is so
Broad.
interesting, really. It's so interesting. Like, you can look at someone, you can dissect the person, you can, it's so interesting. So, but at that point, I didn't know what was going on with me, really. My husband will ask me, if I say, I don't know, I'm just sad. Like, will you go on holiday? I was traveling, like, really, when I moved to Lagos for like the first, I think 8 years, I didn't leave Lagos. Or I didn't leave Nigeria. So, but I do take care of my mental health because I now understand. And taking care of my mental health, it doesn't mean I have to travel out of this. Sometimes I go to resort, sometimes because I just want to live a balanced life.
Yes.
You know, but then I will travel. Even when I travel, I'll still come back to my emptiness. He doesn't also understand. Me too, I don't know what was going on. I didn't know. I think I was just trying to find myself. I feel a lot of women are in that situation. A lot of women, you feel like because marriage is overrated. I know people don't like to hear that, and I can break it down.
Yes.
Marriage, especially in Africa, marriage is overrated. So I feel like, this, I want to get married. In my case, it's not like I even really want to get married. My husband just wanted to get married to me, and we love each other. And I'm like, okay, so what's stopping us? But he was bent, so we got married. So maybe I think, a lot, especially women that are driven,
Yes.
when you get into marriage, a part of you is feeling like, so this is it. So a lot of women will start searching for themselves inside marriage. So you now have children, you have husband, you have in-laws. So it's looking like everything is looking good, but what about my dreams?
Yes.
What about my aspirations? What about what I want to become? So you start asking yourself that question, and you start feeling unhappy, feeling unfulfilled, especially if you are a mobile, upwardly mobile woman. You are driven, you're ambitious. Some women are like that. There are some that are just very comfortable by being the homemaker, and there's nothing wrong with that.
Yes.
But there are some that they just want more. If you are in that situation and you get married, possibility that you be depressed is very high.
Very high.
And you will not know, because inside that marriage, unconsciously you'll be looking for yourself. And everybody will be looking at you. Everything look good. What are you looking for? But you will be wanting to find yourself. I think that was what happened to me at that moment. But I never knew what it was. The moment I found counseling, everything changed. Wow. Yeah.
Okay, so thank you so much, Dr. Tolu, for coming. I'm very,
Thank
very,
you
very
for
grateful.
having me.
Okay, so I just want to have like rapid questions. What are your some of your hobbies?
Sex.
Okay.
Sex will be number one, because you see what you get from going to the gym. You get hormonal benefits,
Yes.
physical benefit,
Yes.
mental benefit, psychological, even spiritual benefit. You're
Dr. Tolu.
so, but
Yeah.
I mean, sincerely speaking, I
Yes.
understand. If I sit down with you and tell you the benefits of sex, if you are living a sexless life, you are not. You are just existing.
Wasting your time.
You're not. You are just existing. You are not thriving.
Yes.
Right. So yeah, sex is my hobby. I like to travel. And I don't know. I like fine dining.
Okay.
Fine dining, sex, traveling. Yeah.
Okay, where is your best location? You have traveled a lot, so where is your favorite place to travel to?
I don't know. I've not really traveled a lot. So I'm in my era of traveling now. And I have a
But
lot
you've gone to
of places I've
Scotland, you went
listed.
to USA,
Yeah.
amongst all of those places you went to study.
Yeah. I don't know. I don't know if I found my favorite place, yes.
You
But
say
I've
you
been
like
to a
fine
lot
dining?
of big. Yeah.
Oh wow.
Yeah, I
You're very
like
young at heart too.
I don't find dining. I take myself out
You just sit
a
down
lot.
alone.
Yeah. In fact, before coming here, I wanted to take my daughter. Oh,
Daughter.
let's quickly just go do lunch. But some things came up, and then I do. Yeah, I do that a lot. I take myself, treat myself to breakfast, lunch on my own. Take myself out to three course meal and have fun on my
Wow,
own.
that's self-love.
Yeah, self-love.
Yeah, do you love Nigeria?
If I don't love Nigeria, so that question. So I love Nigeria so much. If I don't love Nigeria, I would not be here anyway. I don't have reasons to. What am I doing? Like, what I'm doing are things that I can do internationally, and it will be
Yes.
fantastic. But what I'm trying to do now is trying to take, our stories, they don't look too fantastic to me. I know that a lot of people want to sell positive African stories, but I think psychologically, I don't have something positive to sell. So I think what I want to sell is the way I think the world is not looking at us, and they have a lot to learn from us, a lot that will help them to understand human mind, that will make them to come up with new theories that will help. So that's the area I'm working on. I'm working with a lot of international organizations to see how I can push that as well. Right. So I love Nigeria, but I don't think Nigerians are okay. I feel like, if you ask me my opinion about Nigerians, our state of mind, I am hopeless.
It's a mess.
I am hopeless. And people think the government is our problem. Who is the government? The government, you are talking about somebody, imagine a man that grew up with a mindset of scarcity. And the person is your state governor. You will cry. He's not seeing you.
There's no way. You cannot erase
So
it.
everything is tied to psychology, it's tied to mindset, it's tied to upbringing. If we don't deal with that, we are not going anywhere. I don't see anything
100%,
changing
yes.
until we work on our mind. The problem of Nigeria is a mind problem.
The thinking.
And until that is dealt with, we are not going anywhere. So do I love Nigeria so much with the whole of my heart? Do I like Nigerians? I don't think so. I think our state of mind is messed up, and is, for me, I feel very hopeless about how Nigerians are wired.
Okay, who's your favorite artist?
The music or...
Music.
Damn. Hi. Have I ever thought... I used to tell my friend, I like his music.
Do you like
I like her
Ashake?
music.
You like Burna Boy?
I think Davido.
Like-
Davido is the only person I'm following.
Oh, are you serious? Like
Yeah, I like the fact that Davido is I think I'm empathic towards him. I feel like Nigerians like poverty so much and they like poor people.
Yes.
So if you are privileged, maybe by virtue of money or by virtue of wisdom or knowledge, they will not warm up to you.
Yes.
They warm up to people that they feel like they can identify with. And there's a psychological term for that,
yes.
right? So I feel like, I look at Davido like somebody that does not deserve the level of, maybe some level of people that are beefing him. So this is me psychologically trying to like, maybe be empathic towards him.
Yeah.
So I know a lot of his songs. I love him so much. So maybe out of empathy, I think he's the only musician that I'm following on Instagram.
Okay. So my last and final question, Dr. Tolu, you look so beautiful. I want to know how old you are. You don't tell me exact age, but you can tell me the age bracket.
Okay. How do I tell you?
You can tell me the age bracket because I need to know. I showed you your throwback in the beginning. So now I'm confused. Are you living backward? And what are you doing to care for yourself like this?
I'm closer to
60.
Nah.
Yes.
50.
Oh wow, because that's to 50.
Yeah.
Oh wow. Okay, so how do you give yourself self-care in terms of your skin? What's your nutrition like? What do you eat to
So
maintain this
recently I've
youth?
been doing a lot of, I don't do skincare. I don't.
Are you serious?
Yeah, I don't. I just rub cream and get out.
But your
in the
skin-
last few months now, I'm planning my 50th. So you have.
Wow. Happy birthday.
So I've been doing a little bit about skincare, but that's not my thing before. But now I'm doing that now, and of course fruits. I do that a lot. I'm bad with sleep because I work a lot, and most time I sleep. And so I'm not in the school of thought of you must sleep by so time. But now I'm like, you know what? I'm not getting younger. Let me be believing. I've been reading about this sleep, that there's a particular time, because usually I sleep 1, 2, 3 a.m. But I'm not one of I'm not an early riser. You don't catch me in the morning.
Okay.
Right, yeah. Because I go to bed like 3 a.m.
Wow.
So yeah.
Dr. Tolu, you are such an amazing guest.
Thank you.
Ever since
I had fun.
Yes,
too,
me too. Yeah, so I remember writing to my diary. I said I must invite Dr. Tolu this year. And that's why I kept sending you DMs. And I'm so grateful.
Happy that I'm here.
Yes, I'm so grateful that you
are
came.
very fine. I know girls will not let you rest.
Yes, so, no worry. That's between me and you. Yes, because it's affecting my relationships. But,
really?
Yeah, Dr. Tolu, this is not on camera.
They are toasting you.
Yes, it's a lot.
It's okay.
It's okay. Yeah, it's okay.
I mean, it's okay. They are not the reason why you are fine.
No,
so
exactly. It's not my fault. Yeah.
It's okay to toast.
Yeah, talk to
and
me.
it is left to you to say, sorry.
Yeah. I'm sorry. I can't do that. Well, I'm so grateful. Like you, I'm so happy because you're so passionate about your job. You talk about it with so much passion. When we're downstairs, when we're thinking about whether commit is 3 or not, maybe you sat down and started talking. The energy lit up, and yes, we've gone like almost an hour, 30 minutes. Yeah. This is my longest so far, and I'm very grateful to you, ma. Thank you so much, ma. I was going to tell you, I said if I see Dr. Tolu, I'm going to hug her, and I appreciate you so much.
Thank you.
So I'm very grateful.
Yeah.